policy change and mental health and support for these at-risk communities really needs to be part of our day to day and part of our guidelines. And at this point, we don't have anything specific to guide us towards these populations. And that's also the same with, women with disabilities as well.
Mm, that's a really good point. So what I'm really hearing you say is it's not just about biology, it's the systems, it's the access and the advocacy to around all of these that are also impacting our heart health for women particularly. Welcome to the new chapter of the Her Resources podcast. I'm your host, Linda Misakadis, and I'm so excited to be stepping into this next season with you solo. This podcast has always been about amplifying women's voices, exploring the challenges we face in HR, leadership, and life, and sharing the tools and inspiration we need to thrive. And now, I'm taking that mission even deeper. You'll hear real conversations with bold and authentic women, as well as reflections from me on everything from pay equity and burnout to confidence, leadership, and the messy, beautiful journey of growth. This is more than just a podcast, it's a community, a space for us to learn, lead, and lift each other up. Welcome to this new beginning. This is the Her Resources podcast. Let's get started. Hey everyone, welcome back to the Her Resources podcast, where we have the conversations that help women lead better, live stronger, and make informed decisions about the things that matter most. Today's episode is personal and it's urgent. Heart disease is the number one killer of women in the United States. Not breast cancer, not something rare. Cardiovascular disease accounts for 1 in 3 deaths in women, and yet most women still don't see themselves at risk. Even more alarming, 90% of women have at least one risk factor. So why aren't we talking about this more? To help us unpack what every woman needs to know, I'm joined by Dr. Hamad, Director of the Advanced Heart Failure and Transplant Program and Director of the Cardio-Oncology Program at Temple University Hospital. She is also a leader with the American Heart Association's Go Red for Women's initiative. Today, we're talking about the real numbers behind women and heart disease, symptoms that look different in women, the role of race, ethnicity, and access to care, modifiable versus non-modifiable risk factors, and the practical framework, Life's Essential 8, that gives women real control. This isn't about fear. It's about information. It's about agency. And it's about being your own hero when it comes to your health. So let's get into it. Welcome to the studio, Eman.
Thank you so much for having me. I'm happy to be here and improve the awareness and increase awareness about heart health in women.
I'm so excited for this because, if we kind of start with the big picture, when you look at the data, what should women really understand about cardiovascular disease?
So, as you mentioned, cardiovascular disease is the leading cause of death for women in the United States, 1 in 5 deaths. Also, more than 44% of women in the US, which is about 60 million, are living with some form of heart disease. In
Wow.
2023 alone, more than 900,000 people in the US died from cardiovascular disease. It really is
Wow.
about one death every 34 seconds.
Oh my gosh, when you say it that way, it's like it's really impactful to think about that happening.
Yes, it's a significant amount, and that's why we all can do something about it.
Absolutely. Why do you think so many women still underestimate their risk? Because I talk to women all the time, and I think they just kind of, they don't even think about heart. We always associate heart and men for some reason.
Yeah, I think there's a lot of reasons for that. Number one, symptoms in women may present differently than men. They're more subtle. They're less than that typical, elephant sitting on your chest type of phenomenon. And then also, many women attribute their warning signs. So it's stress, it's fatigue, it's aging, it's just a bad day. And then the big part is the historical bias in research. So
Mm.
women have traditionally been underdiagnosed, not included in clinical trials, and they were really not presented as a key factor. It's always been that men have heart attacks, men die from heart attacks, and that's what we've always heard, even though women and men the number one killer is heart disease. But this was never highlighted for women, so it's not the message that has been delivered, and they have not been studied in clinical trials. Research till now does not have them represented as well as men. They're not diagnosed as often as men are. They're not taken seriously as often as men are either.
That is so true. We have a friend of our podcast, Carrie Lentman, who came on and spoke to us last February talking about women's heart health. She was a young, healthy woman, in her 30s. She was triathlete, all of these things. When she went to the emergency room after, encouragement from her friend, they did not look at her heart until probably hours after she had been at the emergency room as she told her story, because they checked everything but her heart. Yet I always use the example, I've gone to the emergency room with my husband before with a non-heart related, nothing going on like that. And the first thing they do is
Mm.
check his heart.
Right.
It's the
To get an
very first thing
EKG.
they do. Yeah, it is just amazing to me. The statistic that 90% of women have at least one risk factor, that's really staggering. What are the most common ones that you see?
So high blood pressure is a big one. It affects 1 in 3 women in the U.S. Diabetes is another one. 12% of U.S. women have diabetes, and women with diabetes are known to have higher risk of heart disease and specifically heart failure. And in addition
Wow.
to that, high cholesterol is another risk factor. These are kind of the top three, but of course, obesity, smoking, poor sleep, inactivity are also other risk factors, with the three being high blood pressure, high cholesterol, diabetes.
No, that makes a lot of sense. You brought up the crushing chest pain. And I think that is one of the things where we do go wrong, right? Is because symptoms, as you mentioned, in women can really look different. What are some of the most common heart attack symptoms that we see in women?
So, women can have subtle chest discomfort. They could have neck pain, jaw pain, back pain, shoulder or arm pain, cold sweats, a heartburn that's not going away. Sometimes it
Okay.
is heartburn, but it's just persistent and not going away. So that needs to be addressed. Sometimes nausea. And it's really just
Mm,
knowing your own body and you feel different. Something is not right. Shortness
okay.
of breath. So, sometimes they can present with just profound fatigue and a sense of just
Mm,
feeling, unwell. And
yeah.
that needs to be taken into consideration. If your symptoms are lasting, more than usual, this is not your usual, I had a long day, I'm tired. Seek help. It doesn't hurt to go, see your care doctor and see if something is going on, just to make sure that it's nothing that you really need to pay significant attention to, like a heart attack.
That makes a lot of sense. What are some of like those subtle symptoms that women are more likely to dismiss? So you kind of mentioned heartburn, but there are some of those other things where women, and I think because women internalize so much, and I also think there's an underestimation of the amount of stress that women are under, that oftentimes we're kind of ignoring things. So what are some of those subtle symptoms that women tend to dismiss?
I think we mentioned the heartburn is one of them. We mentioned also fatigue that's just not going away. If you also have
Okay.
symptoms with doing things, so you're used to doing your day to day, going up the stairs, running around, and then now with activity, you're starting to feel symptoms. That's a sign as well that you have symptoms with activity. Also, if you start having persistent jaw pain or arm pain and it's not going away, and there was no reason for you to have arm pain, you didn't work out, you didn't lift anything heavy, and this arm pain is coming from nowhere. So things like that, we
Okay.
tend to dismiss, and we shouldn't. We should get that assessed, especially if we know that we have risk factors.
That's a really good point, because I remember Carrie telling us as well that it wasn't until she mentioned her family history of heart disease. And again, very healthy, young, triathlete, not who you would expect to present with symptoms of that. When they started kind of digging in after they'd done all these other tests and they started to dig in a little bit, and she happened to mention that she had a family history of heart disease, that's when they finally actually looked into that this could be something going on with her heart. So kind of knowing that history as much as we can is also, it sounds like, very beneficial.
Exactly. And, as you mentioned, so younger women are, so ages between 18 and 49 are more likely to be misdiagnosed when it comes to heart disease. And actually, studies show that, women who come in with this atypical chest pain wait 11 to 12 minutes longer on average to receive emergency care as opposed to men who, get the EKG right away.
Yeah. Yeah, that makes a lot of sense. Well, and it seems to me too, and I don't know if you see this happening, but are women often misdiagnosed because when they present with symptoms, is it a misstep in the health system? Is there, like, what causes that? You would think that if somebody goes in, a woman goes into her doctor or especially into the emergency room and she's presenting with symptoms, why are we so often misdiagnosed?
Yeah, I think it's just because of the difference in the presentation, and also like we don't elaborate or emphasize our symptoms like men do. So,
Mm, mhm.
if a woman presents with some chest discomfort, it's she puts it lightly. I've been having some chest discomfort where as opposed to men, they would tell you there's like an elephant sitting on my chest. I can't breathe. They take things, extremely heavily.
Yeah,
And I think that presentation is what pushes more for the early diagnosis of chest pain, in men. And I think, in some ways, women hope that, they're gonna say, "Oh, everything is fine. You can go back home and, do what you
yeah.
really wanna do, which is your family, your kids, everything else."
Right. Yep. No, that makes a lot of sense. The other thing you talk about as well is that one size does not fit all, that there's a lot of disparities in women's heart health. And one of the most powerful themes in your work is that whole idea that one size doesn't fit all. How do race and ethnicity actually impact cardiovascular risk?
So, race and ethnicity definitely have, a big emphasis when it comes to cardiovascular risk. So, specifically Black and Hispanic. So, cardiovascular disease affects 40% of Black women in the U.S., and Black women have a 40% higher incidence of hypertension and 14% higher incidence of diabetes. So, they have that higher presence of those risk factors, and that leads to more cardiovascular disease. Similar with Hispanic women. So basically, they have a 30% higher risk of death. Hispanic women have 20% higher risk of cardiovascular disease compared to non-Hispanic white women. And when you look at their risk factors, higher risk of obesity, about 44%, diabetes,
Mm,
15% higher. So their risk factors are more significant, and that leads to more risk of developing cardiovascular disease, in addition to genetic variables as well and family history as well. And, going into also all the social determinants of health plays a big role as well here when it comes to ethnicity.
yeah, that's what I was wondering a little bit, is that how much does socioeconomics play into what's going on with women's health? Is it that, is it access to healthcare? Is it access to healthy food? Is it, are there, what are those things that are really impacted? Because it does seem like it is very disproportionately affected for these women. And if you take the genetic side out of it and really just kind of look at the socioeconomic impact of it, I'm curious, what are some of those things that are happening?
So, I mean, social determinants of health definitely play a tremendous role. So, income, can they afford medications? Can they afford good food? We always say, we need to eat healthy, low
Mhm.
cholesterol, low sodium, but, oftentimes the cheaper options are not healthy. They don't have low cholesterol, they don't have low sodium. And then access to healthcare, how hard is it to get to a facility that has clinical care, et cetera, because sometimes these facilities are not present in their community. And
Mm,
that's why community health centers are, something that has been starting to kind of develop more frequently in these areas to really help people by going to their community as opposed to having them having to go out. In addition, education is another one, right? Being educated
mm.
about the risk factors and, taking medications. I have a lot of patients that, who just think that medications are harmful. They don't want to be on a lot of medications, not realizing that, preventing and controlling risk factors is how you don't get the sequelae of what
Mhm.
not preventing these risk factors, which is cardiovascular disease, including stroke, heart attacks, heart failure, etc. Not to mention the extensive outcomes that can happen from uncontrolled sugar. Um, so all that I think all together kind of, makes it for, these patients to have social determinants of health be a huge impact on how they eventually do.
Is that true in the research as well? So, if women are already underrepresented, I'm guessing that women, Black, Hispanic, well, really even cultural, are there cultural variations that are being included in that? I'm guessing that those are even more underrepresented if women in general are probably underrepresented.
Yes, 100%. I mean, our research so far shows that there is a disparity in the treatment intensity when it comes to women as well. Medication initiation, timely diagnosis for women, the invasive testing that is done for men might, take a while before it's done for women. So there's definitely, as far as diagnosis, treatment, and inclusion in research trials. So, clinical trials have chronically been under enrolling women and under enrolling, women with various ethnicities as well. So, all in all, women on in all walks of life are underrepresented in clinical trials. Of course, there is a push, and there is a realization that this is not representative of the population that we are treating. But I think it's going to take a long time before we kind of make this right.
I have exciting news. The Her Resources podcast is opening sponsorships. If your brand supports women in HR and leadership, think talent, well being, learning, pay equity, coaching, productivity, or mission driven tech. This is your moment. Our listeners are decision makers and change makers who show up for real conversations and practical tools every week. We offer flexible options, pre-roll or mid-roll host reads, series sponsorships, and thought leadership integrations that highlight your story without the fluff. Ready to connect with a highly engaged audience and grow with us? Email contact@herresourcespodcast.com and put sponsorship in the subject line. I can't wait to collaborate. Do you also see that in the gaps with insurance and even health access? So aside from just getting access to insurance, are the insurance guidelines also maybe biased more towards one than the other? Because oftentimes we see that treatment plans are sometimes driven by insurance requirements. And is there any correlation between the treatment that women are getting versus the treatment that men are getting because of insurance?
I don't think from an insurance standpoint that there is a difference when it comes to that. However, sometimes, tests are not approved and you need authorizations, and authorizations go to an expert in the field, medical personnel who have to review the case and give you authorization. So there is ways where that bias can be present because there's a human decision making and not just by codes and by diagnoses. So that is possible. But does it have a big impact? I don't think there is anything that I could say or aware of that is the case.
No, that's good to know for sure, because you do always, in the back of your mind, you always wonder about those sorts of things as well. Do you find that women are less likely to receive that guideline-directed care compared to men? Because it does seem like maybe that also factors into. So, how are we providing that guidance to women as far as protecting our health and our hearts, particularly?
Yeah, definitely there's a less intensity of treatment. So, we have our guidelines to intensify specific treatment and initiate specific medication. And we know that women are less likely to get their treatment intensified per the guidelines, less likely to get medication initiation per the guidelines as compared to men. And it's more particular for women of color.
Interesting. Do you see, like, are there also, do we see anything in the LGBTQ community where there is that again, kind of that one size fits all? What do you see there? And even for veterans, I'm kind of curious, like, what are we seeing there as well?
Yeah, I'm sure for both these areas, there is a disparity as well. Just because they're not everybody is basically certified to treat LGBTQ, and not aware or have the training needed to treat LGBTQ, and also veterans as well. So policy change and mental health and support for these at-risk communities really needs to be part of our day to day and part of our guidelines. And at this point, we don't have anything specific to guide us towards these populations. And that's also the same with, women with disabilities as well.
Mm, that's a really good point. So what I'm really hearing you say is it's not just about biology, it's the systems, it's the access and the advocacy to around all of these that are also impacting our heart health for women particularly. So let's talk a little bit about risk factors, like what we can and what we cannot control. What are the non-modifiable risk factors women should know?
So, the non-modifiable risk factors are risk factors that you are born with in a way. So, your age, you can't change your age. It's going to continue to change, and you have no control on it. Your family history, if you have a history of premature heart disease or a genetic a disease, race and ethnicity, you can't change that.
Mm,
Hormonal changes, so things like menopause, pregnancy, the hormonal changes, those are things that you cannot modify or change. So those are things that are intrinsic that you must be aware of and you must
mhm.
let your providers know about. So this way they could help and take them into consideration when they're looking at your modifiable and non-modifiable risks and trying to put a plan to put a treatment plan together.
How do you advise? So I think about like myself, I don't really, my father was abandoned as a baby. I don't really know anything about his actual, health history in his family. I know what he kind of went through, but I don't think he even knew what he went through. And then my mother, very similarly, she immigrated here from the UK, and I don't really know any of her family. What do we do in those situations where we don't really have a good idea of what our history and background and family, where that all comes from?
Yeah, so I think just the family history basically of your parents, your siblings, so it doesn't have to be, their your grandparents. At least, your mom has ABCD, your dad has ABCD,
Hmm.
your siblings have coronary disease or not. So things like
Okay.
that. So it could be your direct family.
Okay. Okay. That's good to know
Yeah.
because I think sometimes we always think we have to know our entire lineage in order to be able
Yeah.
to provide that kind of health history. So that's really good to know. What are the most powerful modifiable risk factors?
So that's a very important one. Looking at the modifiable risk factors. So, I always say we all should know our numbers. And when I
Mm,
say know your numbers, so, and this is part of the American Heart Association recommendation for the, essential 8 factors to look at. But your blood pressure, you really need to know. That's the number one, blood pressure. If there's anything that you should know, it's where your blood pressure runs. A lot of people have high blood pressure. They're unaware of it, and usually people, when they are diagnosed with high blood pressure, it's years later. And by the time,
mm,
sometimes they could have, the effects of the high blood pressure, like, heart failure or, strokes, et cetera, et cetera. So high blood pressure is something that you should know if you have, and you should have your blood pressure checked on a regular basis, depending on your age and, at least have an annual checkup. So your blood pressure, the targets every year keep on going down because we're finding more and more that blood pressure is linked to poor outcomes. So 120 over 80. So it should be less than 120, less than 80. So that's
okay.
where the goal is. And looking at modifiable risks for blood pressure is something important to do as well. Am I eating too much salt? Maybe that's why my blood pressure is high.
Mm,
Is my BMI high? That's another thing that we're going to talk about. So there are a lot of things that you can change to help bring down your blood pressure. Exercise can also bring down blood pressure. So blood pressure is number one. So I'd say know what your blood pressure is and know if you need to bring it down. And if you need a medicine, that's
mhm.
okay. Don't say, I
Okay.
don't want medicines because I don't like medicines. If your blood pressure is high, you're putting yourself at risk for all the sequelae of having hypertension. So blood
Okay.
pressure is medicine is okay as you fix your lifestyle, lose weight, etc. And then you could always check your blood pressure. It doesn't mean that you're on the medicine that you can't come off of it, but you need it for now so you don't have the sequelae of hypertension. So that's one. The next one that we talked about was cholesterol. You want
Mhm.
to know what your cholesterol is. You want to know, your non-HDL cholesterol should be less than 130,
Okay.
and depending on what your risk factors are, the LDL should be less than 100 or less than 130. It all depends on how many other risk factors you have, but you should know what your cholesterol is and ask your doctor if you are at goal or not based on your own risk factors. And then sugar, so diabetes. So A1C, which is a number, a lab value that tells us what your blood sugar control has been over the past 3 months or so, should be less than 5.7. And your
Okay.
fasting blood sugar should be less than 100. And those are on the lab values if you go to primary care and you get your annual assessment. And then the fourth one that we need to look at is our BMI. Everybody should know what their BMI is because that has also been linked to poor outcomes. So these are four health factors that you should know and work on optimizing because you can make a difference with them. And we talked about being your own hero. This is really how, because you know that these four factors, health factors, can be improved and you can work on them. The four factors that are behavioral factors are number one, smoking. We all know that it's
Okay.
harmful, including vaping. That's
Yeah. Oh,
that's
okay.
just as harmful. And then sleep. Actually, the AHA Essential 8 were 7, and recently they added the sleep to it because sleep is very
Okay.
important. Sleep is when your body regenerates. Sleep is when you get the rest you need. Sleep is when growth and development takes place. So sleep is very important. And a lot of us, say, oh, well, it's okay. I'll make it up on the weekend. It doesn't work like that. You really
Mm.
need every night to get a good amount of sleep, and that's necessary. Anywhere between 7 to 9 hours, depending on age, but adequate sleep is necessary. And then the other thing is a healthy diet, eating healthy food.
Mhm.
There are always ways to make good food, low sodium, adhering to a DASH diet, which is more of Mediterranean, low sodium diet. So trying as much as possible. I know sometimes financially it's hard, but I
Mhm.
think if we try and change one thing at a time, we'll be able to
Yeah.
improve how we eat. And then the other big one is physical activity. Physical activity is linked to everything from cardiovascular disease to diabetes to hypertension. So having a good amount of physical activity, even if it's walking, you don't have to go to the gym. The AHA recommends 150 minutes of moderate intensity aerobic activities or 75 minutes of rigorous aerobic activity if
Mm.
you're able and you're an athlete. But even if you alternate, you basically in between your work hours, you go for a walk, and
Mhm.
you do speed walking and then you slow down. You get your heart rate up. If you watch your steps on your you have one of those watches and you watch your step or on
Mhm.
your phone. So you could do that just every day in between lunch, at work, at home. They have all these videos and where you can just log on and do a little video for 10 minutes. You could use canned soup as light weights, just to get a
Yeah.
little bit of resistance. So I think it's having the will to do something to make a difference
Mm.
in your health, but the way is there. So if you have the will, you will find the way to make these simple changes. And those are kind of the healthy eight that we should do. And I always, to the healthy eight, I add my ninth, which is learning
Uh-huh.
CPR. I always say
Oh, okay.
learning CPR is critical. If you're at your job, know where your AED is. But learning CPR because you can save a life. So I add that to my, behaviors. To me, it's like another one that everybody should learn how to do CPR, be aware of the
Absolutely.
AED.
Are you ready to take your podcast to the next level? Let LJM Productions help you sound your best. We specialize in podcast editing, production, audio restoration, and mixing, ensuring every episode is polished, professional, and ready to wow your audience. Whether you're just starting out or a seasoned podcaster, we'll handle the technical details so you can focus on sharing your voice. Partner with LJM Productions today and hear the difference.
Yeah. Well, so a couple interesting things that you said that I think are good reminders to everyone is that you didn't say that you have to now become a world-class athlete
Yeah.
to take better care of your health. What you said is it's little things. So 10 minutes here, 20 minutes there. Like it's just simple things that can really help increase that physical activity. You don't have to run a marathon. Take a walk around the block, walk on your treadmill, walk around the house, whatever it is. It's just those kind of simple things. What I'm hearing a lot anymore, I've seen a theme this last year is that we all, and maybe it's because of the internet or social media or whatever it is, we're always still looking for that easy button. We think if we read the book, if we watch the video, if we listen to the podcast, that's where the work happens. But we all know it's exactly what you said. It's just putting that action into it. I'm curious your thoughts too with nutrition. What are some simple changes that someone can make? So, if you are a varying socioeconomic and what you have available to you, what are some little modifications that you can make just to, help make things better?
I think that the first thing is really the salt shaker. So, we all are used to, putting that salt shaker on top of food. A lot of people don't even taste the food before they put the salt on it.
That is true.
Our taste buds change every 10 days. So if you program yourself, say, okay, I'm going to change my need for salt and just, cut the salt out or make it much lower. 2 grams is what the AHA recommends. So if you do that for just, a week to 10 days, you'll
Hmm.
stop wanting the salt because you will lose that. You'll start tasting the food and you're like, oh my God, this is salty food. So we could do that. We could
Ah,
change
interesting.
how we sense and taste things. Same for coffee.
Yeah.
A lot of people, they put tons of stuff in their coffee and these shakes and, whatever, they go to all these coffee places, but it's like 1,000 calories in that one drink because of all the sugar in it.
Yes.
But then if
Yeah.
and a lot of folks, you go on a diet, like, okay, for this time period, I'm not gonna put any sugar in it. And with time, your taste buds change. And if you
Right.
go back to your old habit and put all that sugar in it, you're gonna notice it's too sweet for you. So there's ways
Okay.
that you could train your taste buds. So, maybe start with, okay, I'm going to train my taste buds to kind of change how I work with salt. And then, okay, now let's work on, some of all this sugar and syrup and whatever that I put in my, coffee in the morning.
Hmm.
And then you'll take away some of that. So really baby steps. And then, okay, maybe I'm going to make sure that, when I go even to fast foods, maybe I take the salad instead of the fries. Maybe
Okay.
I take, a happy meal instead of a big meal. So, even portion control if I can't afford it. So there are little things that we can do, to help optimize things. Um, you
I
know,
like that. Yeah. It makes a lot of sense because I do think that sometimes, and I know I've fallen victim of this myself, it's kind of like this all or nothing. So either
yes.
I go all in, kind of, I'm jumping in with both feet. And then if I fail at all, then I throw it all out the window. Oh, I failed. And so now I can't do this. It's not possible to do that. And so when you get those feelings of overwhelm, how do you reset yourself and get back to a place of center to go, it's just one thing?
I always say, and my patients do this all the time. Like I notice that, when they first start, they go, all the way up to the top of the mountain, but then they fall. And I'm like, it's all about
Yes.
moderation. It's all about moderation.
Okay.
I'm not asking you to stop eating salt completely. I'm not asking you to
Yeah.
take out all the fatty foods, right? You have to have something because you're human. The moderation
Mhm.
is the key. So find out where you could cut it out, right? You don't have to have, eggs and bacon every morning. Maybe cut out the bacon. Maybe, figure out what's going to work for you and also at the same time give you, quality of life. You want to enjoy life. So if you take it all out, it's not going to be something that you would continue with. So it has to be, you take some things away. And also don't start with everything. If you notice that it's just too much for you, well, start with one thing at a time. whether it's food, exercise, tracking your blood pressure, working on your cholesterol. When I have, the events at work with, be your own hero and especially with Go Red Day, I say just pick one or two things that you think are your
Mm,
top priority. If you have high blood pressure, then work on that. Forget about
yeah.
everything else. Let's just work on bringing down my blood pressure. And how am I going to do that? Okay, I'm going to, I have to cut out some salt because I want to bring down my blood pressure. Exercising does cut out, bring down some of the blood pressure. I'm going to take my meds. So I'm just going to do this and focus on bringing down my blood pressure. Okay, then we did that. And I'm going to plan out that, next thing, I'm going to stop smoking. I'm going to have a quit
Mm,
date. So I'm going to say by New Year's, by my birthday, by my anniversary, whatever that date is. So kind of doing one thing at a time as opposed to bombarding yourself. So you're setting yourself up
mm.
for failure. Moderation is the key. Just, do what you think is possible. And I think always remember your why. Why are you doing all this?
Mm, good point. Yeah, no, I really like that. What look, can we talk about weight a little bit? Because I think that there's a lot of different opinions about it. So we hear that BMI doesn't really matter. It's if you're healthy, you can be overweight and still be healthy. You can be normal weight and be unhealthy. Talk a little bit about weight and where we really do need to be and what is important in all of that, because I think in the world of body positivity and everyone trying to, sometimes we lose sight of the health side of it all because we get focused in on the vanity side of it all.
Yeah, so there's a lot of studies on BMI. So BMI is important. Your weight is important. The abdominal obesity, the fat, the circumference. That's also been linked to poor outcomes. So weight definitely does matter. And BMI, does include your height and your weight. But there are
Okay.
other measures as well, if you want to look at it. But even just having that abdominal obesity, that circumference, that's also something that's been linked to poor outcomes. So, being healthy does mean that, you lose the fat weight, that you'll have less of that. And I would say, if you're not, in the, overweight and obese and you're kind of in that moderate arena, you don't have to continue to lose weight, but you do want to get yourself at least where you're not in the obese arena, which is a BMI of more than
Okay.
30.
I think that's really helpful because there is a lot of, I think there's just a lot of confusion out there around weight. And like I say, I think sometimes we get confused between healthy and vanity. And those are two very different things if we're talking about
Exactly.
looks versus health, right? So, I'm curious as well, what are your thoughts on there are a million devices and apps. Like right now, I'm wearing my Hoop band, I've got my Apple Watch on, I have my Welltory app, I've got all of these different things that are telling me constantly about all the things that are going on. What do you think about that? And is it good? Is it bad? Are we going over the top with tracking everything? Like, what are your thoughts around that?
Yeah, I think it's helpful if it's going to motivate you. A lot of
Okay.
folks, they look at their watches and they see how many steps they do every day, and it motivates them. Like, I have my patients that come in and they track and they tell me, for the past week I've been doing 10,000 steps, and if I do less, then I start doing, walking around my house or going in the backyard or like it just helps them. It motivates them to get to that target, every day. So if that's the case, then that's great. Um, some people look at it and they're like, "Oh my God, my heart rate went up to 60, my heart at 70, my heart at 90,"
Hmm.
and it just stresses them out. So
Yeah.
that's not a good part. But also, some of these watches for people who do have heart disease, do have irregular rhythms, like atrial fibrillation or some other abnormal rhythm. Some of these watches can actually help track and can help track if your heart is going really, really fast when you're just sitting, resting for no reason. So there are some clinical reasons to have that, but I think in general, it's good for you to track your steps to motivate you, to help you kind of reward yourself. I did my 10,000 steps today. Oh, I went out today and I did 15. So it's helpful, I think, if you want to use it that way, but I wouldn't go over the top and, you don't really need a watch that tells you exactly what your rhythm is, unless you really
Right.
have some heart disease that you're trying to track and help communicate with your provider.
Yeah, no, that's really helpful. And I like that because I do think that we tend to get obsessed with the technology then. And then to your point, it does stress you out. Because I know even I found myself looking at it going, oh, now I got to go and do something. Not because I wanted to go and do it, but because I am highly competitive with my own self, even. And I'm like, oh, I've got to go do this because of that. I lose sight of my why. My why in doing all of
Yes.
these things is so I am healthier, I feel better, not so that I can just achieve a goal with no purpose behind the goal. So I think that's a really great way to level set. Let's talk about sleep a little bit more because I agree sleep has really come into play, and that's another one where you've kind of got these different schools of thought. You've got some of them where like the 5 a.m. club and just getting up earlier and powering through it. And I remember watching Terry Crews talking about this that he was someone highly motivated, go 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 go, and he was convinced he could exist on 4 or 5 hours of sleep. And then he got very sick. I don't remember what health issue he had, but it was all tracked back to sleep. A lot of what was going on was he was not getting enough rest for his body. Now he's a big advocate proponent of getting at least 7 to 8 hours of sleep. He doesn't subscribe to the no pain no gain motto anymore. Talk a little bit more about sleep and why we're finding out how important it really is to our overall health.
Yeah, I mean, we know, and there's many studies that basically show us that your body, your cells regenerate during sleep, and growth and development happens at the same time as well. Your brain, your neurons, everything basically during sleep is that time for it to rest, regenerate, rebuild. So it's critical for us. And, waking up early is great as long as you had your good amount of time. So waking up early means sleeping early. You can't sleep at midnight and then wake up at 4 a.m. and then just have the 4 or 5 hours of sleep because that's not enough for your body to regenerate,
Yeah.
for hormones, for everything. So, and you'll notice if you have a good night's sleep, you feel refreshed. And then if,
Hmm.
if you have that, 4 hours, or you feel that you didn't go into your deep sleep, you didn't reach that level, so you really didn't reach the area where your body can regenerate. Even for things like day-to-day activities and school and taking tests, etc. A good night's sleep is necessary for all that information, to actually build in your brain and in your system in order for you to be able, to take tests. And we see that, especially during in college students and boards and things like that. You're all night studying, but then the next day in the test you crash, because you just can't do that. Your brain, your body needs that time, so that has to be incorporated. There's nothing like a good night's sleep. At least 7 hours, and of course, the younger you are, the more sleep you need, as your body regenerates. So for kids and teenagers, etc., they need longer time. But 7 hours is kind of a minimum.
Yeah, how
Yeah,
often should we go in and get screened? So if we think about the essential eight,
yeah.
how often should we be
So
going in? Because I
annual,
do think we have a tendency to push it off.
yeah.
Okay, so
So
every year we
annual,
should at least be
but
going and getting
if
that.
you have these risk factors, let's say you're watching your diabetes, you're watching your blood pressure,
Hmm.
then you should go in more frequently and these until these are controlled. So
Okay.
annual, if you don't have these risk factors and you're just going to check to see if you have them. So cholesterol, hypertension, what your sugar is, what your BMI is. And then if you're diagnosed with blood pressure, then you want to go in more frequently. So I would say 3 months, 6 months until it's controlled. And then, based on that, you could go in less frequently. But having risk factors means they need to be controlled, and you need to continue to follow until they are 100% controlled because you definitely don't want to develop the sequelae.
Yep. No. What does early detection really look like? So when we talk about early detection, what does that mean?
So early detection is basically, if you have high blood pressure and you getting your checkups every year, and I diagnose you right away, that means your body has not struggled with high blood pressure for a very long time, because then you
Okay.
could see, harming the kidneys, harming the other organs, harming the heart, more risk of stroke. So, and unfortunately, this is what we find. Some people have it 15 and 20 years.
Mm,
Black and Hispanics are more commonly known, especially blacks, to have high blood pressure for a very long time before they're diagnosed, because by the time we see them, we see the sequelae, we see the heart failure, we see the kidney disease, we see all the things that, we could have saved them from if we had diagnosed the blood pressure early on. And I think that's one of the reasons that, the guidelines for blood pressure keep on changing.
okay.
When I was training, 130 was normal. And with time now it's less than
Uh-huh.
120 over 80. So we're looking at lower and lower and lower targets because of what we see.
Hey everyone, we're the Her Resources podcast, where women share real stories, real lessons, and the resources that help them succeed. We're always looking for inspiring women, business leaders, creatives, educators, and changemakers who want to share their journey and empower others. If that sounds like you, we'd love to hear your story. Reach out to us at contact@herresourcespodcast.com and let's start the conversation. So, when you're out there presenting, your presentation ends with a powerful message, which is be your own hero. What does that mean to you?
So, we all, and especially women, are the nurturers. They really care for everybody else and they put themselves in the end. You cannot care for everybody else before you care for yourself, because you have to be present in order to do that. So you can be your own hero by knowing your numbers, knowing what you need to do to take care of you, not waiting for somebody else to come tell you. Be your own advocate, fight for yourself. So knowing your numbers mean you could actually know that there's something that you need to fix, and then fix it and work on it so you can have a better outcome. We tend to wait for others to help, or to help others first, but we really need to focus on us in order for us to help everybody else.
I really like that message because I do think that women are not always very good at advocating for our own health, especially in clinical settings. I think we struggle to go in and to know, and I think sometimes because we're dismissed, we have a tendency to just be like, well, it must all be in my head. So how can women advocate better for themselves besides knowing their numbers? Like, how do I go in there and stand up for myself when I feel like I'm being dismissed, but I know that there's something that just doesn't feel right?
I think education is critical. So basically, if you know that you have risk factors, and knowing what the risk factors for heart disease are, and you have a family history of it, and you could say, like, I have high blood pressure, I have diabetes, and I'm having this chest discomfort. So I have risk factors for having coronary disease. So does that mean that I need to get further testing? And even going further to say, do I need, knowing that you could get an EKG or a stress test or things like that. And also, if you don't have that information, but you're not sure that you trust what your provider told you, always seek a second opinion. Say, okay, I'm going to get a second opinion. There's nothing wrong with that. Get a second opinion, because even if it's the same thing that was said to you, at least you know that, okay, this is accurate. And sometimes it's good, in order for you to feel good. Ask them to explain. Okay, so I have high blood pressure, I have diabetes, but you're saying I don't need any further testing. How do you know that I don't
Mm,
have, coronary disease? And they'll explain to you, well, you had a stress test a couple of years ago, and the guidelines tell us A, B, C, D. So ask more questions. And, physicians and providers in general, if you're asking more questions, they will tend to answer those questions.
okay.
And, look into guidelines and answer questions and tell you what the guidelines are and give you that information, so this way you can feel settled as well, and have build that trust and that bond between you and your provider.
Now, should I start with my primary care physician, or do I immediately jump into, do I schedule an appointment with a cardiologist? I mean, where should I start my health journey?
So the primary care physician. So the primary care
Okay.
physician can do all this risk stratification that we're talking about. So they can
Okay.
help you know the numbers. They'll tell you what your cholesterol is, your blood pressure, are you at goal or not, what your BMI is, what your A1C for sugar is. And then they could also talk to you about, smoking, about, what kind of diet, how much exercise you're having. And of course, risk factors for everything else from, the different kinds of cancer screening that we need to do from skin to GYN, et cetera, et cetera. So they can do all that and basically risk assess you. And then if they
Okay.
feel that your risk factors make you at a higher risk, they can refer you to cardiology. If their EKG was abnormal, your blood pressure is abnormal, you're having symptoms, they can actually refer you to cardiology. They could even get the stress test or the ultrasound of the heart, the echocardiogram, to get more information. So this way it's available by the time you go to the cardiologist. And they could give you information too. So you can ask, how is my hypertension making me at extra risk for cardiovascular disease? Can you give me information? And I think patients sometimes don't know that they can ask more questions. They can get more information. And I think it's because, providers are busy and they're seeing all these patients. But still,
Mhm.
take your time and ask the questions you want to ask so you feel heard. You need to feel that you are heard.
I like that advice. What would you say to the woman who's listening who hasn't seen a doctor in years?
I would say you really need to, be your own advocate, be your own hero. You need to get a checkup, know your numbers. Anybody who's listening who doesn't know their numbers, you have homework to do. You really need to know your numbers. If you don't know what's hiding there, then you can't treat it, but you will be treating the sequelae of it because that's what you're going to feel. You don't feel the high cholesterol. You might not feel the high blood pressure unless it's really, really high
Mhm.
and causing you headaches or strokes, etc. But you want to treat all those because you don't want to end up feeling the heart failure, the stroke, and everything else that all these comorbidities can cause. You want to treat it when there's time to treat it.
That is really good advice. Kind of a final reflection question for you. If every woman listening today did one thing this month for her heart, what should it be?
If anything, I think the key thing is your blood pressure. If you're going to look for one
Okay.
thing to make sure you're controlled, hypertension is linked to a lot of cardiovascular disease, a lot about outcomes, stroke, heart failure, and it's one of the highest risk factors present. So at least know your blood pressure. Make it your goal to know your blood pressure and make sure you're under 120 over 80. And if you're not, then you need to do something about it, seeking a provider, getting medication, and also working on your salt, working on your exercise to lower some of that, BMI, etc. All that can help with lowering blood pressure. But at least know that one thing.
That is great. Really good advice for everyone. And for all of our listeners out there, if today's conversation did anything, I hope it shifted something for you. Heart disease is not just a statistic, it is not something that happens later, and it's not something that only affects someone else. I think that's one of the worst. I've had a couple friends now have had heart attacks, and it makes it more real for you because I do think sometimes you think it's always someone else. And if 90% of us have at least one risk factor, wow, that's something we should be paying attention to. But the good news is, as Dr. Hamad told all of us, many of them are modifiable. Being your own hero doesn't mean being perfect because we're not. It just means being informed. It means asking questions. It means scheduling that appointment, and it means knowing our numbers. That's a number one thing I took away today. So, Dr. Ahmad, thank you so much for your leadership, but also your expertise and in helping women understand that our heart health deserves attention, urgency, and advocacy. Is there anything you would like to leave our listeners with today?
Thank you so much for having me, and thank you for giving me this platform to spread awareness about heart health. And I hope everybody has a wonderful Heart Month. Happy Heart Month.
Yes, happy Heart Month for sure. And to every woman who's listening, this is your reminder you are not too busy, and you are not too young, and you are not too immune. Your health is a leadership decision. And I know a lot of our listeners out there are leaders in lots of different ways, whether it's they're leaders in their home or leaders in their businesses. But until next time, take care of your heart, take care of your mind, and remember that empowered women make informed choices. So if you like loved this episode, like, subscribe, follow, and share with a friend, a colleague, or anyone out there who could use this one. And thank you again, Aman, for joining us. And everyone, this is the Her Resources podcast. We'll see you next time. Thanks, everyone.
Thank you.
You've been listening to the Her Resources podcast, where women's voices, leadership, and growth take center stage. As your host, I'm here to remind you that the journey isn't always easy, but it is always worth it. Every step you take to build confidence, create impact, or use your voice is part of a much bigger story. It's the one that inspires others to do the same. If this episode spoke to you, I'd love it if you subscribed, left a review, or shared it with another woman who's ready to step into her power. And as always, thank you for being a part of this community. Together, we're not just changing conversations, we're changing the future.